Welcome to the Auburn Medical Group YouTube live stream, the entertaining medical live stream where viewers can ask real-time questions of real medical doctors. And here are our hosts, Dr. Mark Vaughn and Dr. Gail Vaughn.
And we're here, the Auburn Medical Group live stream, just like Mr. Ed says on our beginning. And we are, just like it says, Dr. Mark Vaughn and Dr. Gail Vaughn, as the labels say, with our socials there. Thank you for joining us. We have so many people who have already been chatting, and we will be able to make that a part of the show. But Dr. Gail?
Yes.
Welcome to the show. And also Mr. Ed.
Hey, how you doing?
What? You see that guy in the red suit with the light beard?
What do you?
I heard that Santas are going to be hard to come by these days.
Wait a minute. No, not at all.
Not
at all.
Oh, what's happening?
Oh, wow.
Guys, come on.
Wow.
We got to capture that. Look at this.
Wow. We have our very... Can I sit on your lap?
No lap time.
No, how many times do I have to tell you not?
No lap time. Man, if I had a dime for every time I heard that.
Oh, my goodness.
Look at all of these people.
We're starting this.
Everybody's saying hi, Bianca, Cheryl King,
Hello.
Laura
Hello.
Barzak,
Oh, this is great.
Deborah Rocker, Angela O'Reilly. Hi from Manchester, UK.
Oh, my goodness.
Manchester.
And I even
Excellent.
made it subscribers only, and all these people, or
Already chimed in.
subscribers and
Appreciate
members, one of the two. And we're getting all these people participating in the show. You must be really interested in doctor-patient relationships and
Is that what we're talking about?
what medicine needs.
And they're also saying hi to each other here.
Yeah, of course. Oh, yeah.
Yeah, for those of you who are new to this and wondering what is going on here, this show is on a topic, and we will be talking about compassion in medicine and relationships between doctors and patients. It's also a live program with a live stream and a chat during the show, so viewers are a part of the show. If you are watching this after the fact and wish you could be a part of such a thing, then you just subscribe to the channel, hit the little bell icon so that you can get notifications. And we're usually here at 4:30 on Mondays, Pacific time.
Right.
Dr. Wayne, welcome again. So
That's the third time. I'm still here.
we kind
Haven't
of
ran off
both,
yet.
I know, isn't this great? And all of our people are chatting. We are talking about kind of the same thing, both you on your Dr. Green Knight blog, which there's a link to that in the description,
Right.
and also what's been going around in our physician friend group, we'll call it, our Independent Physician Association, talking about compassion fatigue, a book called Compassionomics,
Good book.
focusing in on not only the doctor-patient relationship, but we've talked about it in terms of patient health, but also for doctor health too.
Right.
Yeah. So that's a lot of stuff we have to talk about today.
So where to start?
So I've started the first 3 chapters of Compassionomics. We talk about material from, I notice a lot of the material has been used in meetings we've had with the
Right.
IPA.
Yeah.
Lori's been bringing up a lot of the anecdotes in, or the studies that are quoted in.
Right.
And you also have been talking a lot about it. You being the medical director of service excellence have
Right.
been talking about compassion in medicine.
Yeah, we talked about it a lot because it is part of that patient experience. You want a doctor that is going to show you compassion, right? So the Compassionomics is a good book. So we actually did a presentation on that last year for everyone, and it went over really well. But essentially, it goes into the study of compassion's impact on healthcare in multiple ways. Not only just the non-tangibles, like the experience you have, which actually we can grade that, but malpractice suits, they go down, better surgery scores as far as like outcomes. It's a lot of.
That's one of the things that I was kind of surprised to find in reading this, is that they've come up with ways of measuring compassion. Not only measuring compassion, but measuring the effects of it. Now, measuring compassion is actually a little bit softer than the effects
It's like
of it.
an empathy scale that they use to actually measure it.
Yeah, well, and that's another thing that came out in the book was the difference between empathy and compassion. Empathy being the emotional feeling of
Desire to
feeling bad for your
action,
patient, and compassion being action.
Yeah.
One is feeling, and the other one is action. And compassion is not complete or doesn't even exist unless there's somebody acting on that empathy that they feel. And the study's finding that it makes a difference. Now, the way they measure it is it is a little bit subjective. So they go over and over and trying to find what is reproducible.
Survey.
What is it that we consistently can look at and say, that is compassion, and label it as such. Mm-hmm. But then once they accomplish that, they find that there's ways that they can measure the results by asking patients questions after and doing studies large enough that they actually find, okay, this is making a difference.
Right.
Dr. Ed, were you going to throw in something there?
Well, Catherine B. has an interesting comment. She says, kindness is a superpower, but I can't imagine day after day. It would be very difficult.
Yes. Which makes me think of the first chapter of the book, Compassionomics, because it refers to Samuel Shen's The House of God. Have you ever read it?
I've actually never read it.
You've never read The House of God. So have you ever heard of it?
I know of it.
It was written in the
80s?
60s or early 70s by a resident in the House of God, which I believe is Mass General in Boston.
Right.
A hospital that you just say Mass General and any doctor knows where you're talking about because it is such an icon in the world of academic medicine. And it describes what was going on. And I don't mean this to be anything negative towards that one particular institution. This is kind of an indictment against American medical training in general. And unfortunately, even myself training, 2+ decades later, still seeing, although also I must say I saw efforts to do it. And this is what's so interesting. In reading this book, talking about compassion and mistakes that have been made and continued in the training of young doctors, I thought about my experience in medical school and my experience in residency. I did them at 2 different institutions on opposite sides of the state of Missouri. And I found myself kind of like defending in my mind as I'm reading this, my medical school, St. Louis University, that had many programs in place and had a great bioethics department, had it was actually a nurse. She had her doctorate, but she was a nurse that was teaching us kind of on the compassion end of care for patients, and a great family medicine program, all before we got out into our 3rd year when we're actually working with patients to teach us about things that are like in this book.
Sure.
And I'm sure you probably had some of it at Loma Linda too.
They stress that highly.
Yeah. Then I realized I am making no excuses whatsoever or defending the place where I did my residency, where I was depressed when I got out of medical school and just hating life and having definitely compassion fatigue for 3 years. Sure. 3 years straight.
I'm curious because you trained in emergency medicine, a lot, and there is a certain clientele that you see in emergency medicine that are
especially in that hospital. Yes.
So I'm curious, and I did family medicine. So the patient experience was huge in my training, huge, because as a family doctor in an office, to get people to come back, they're kind of training you to go out on your own. Get people to come back, that's how you do it. So there was a huge emphasis. So I'm curious if just even in the training there was maybe a different emphasis.
Man. Yeah. This book talks about things in training. It just really made me remember in a different way, or look at it differently, I guess, that there was no patient perspective in the institution where I did my residency. All the training I got on that had been previously. It had been good training in medical school. And then this lab. I remember I enjoyed psychiatry. In fact, I looked at psychiatry residencies when I was a student because I enjoy working with making people feel better who don't feel good. Yeah. And I feel like psychiatry, it's true in all of medicine that that's what you're doing as a doctor, but psychiatry is, it's all about the feel side of it.
Yeah.
And then my medical school had a great experience for medical students in psychiatry. And then I went to my residency, and There was no, in my program, there was no psych rotation, period.
Really?
We did nothing about psychiatry. It was all just, if the patient's homicidal or suicidal, call this number and...
That was,
ship
them off.
That was my entire training in psychiatry as far as emergency psychiatry.
Wow.
Such a difference between the two institutions. And I never put my finger on it before. I never really had it in the front of my mind, the difference between the two institutions.
Sure.
And it makes a huge difference how the doctors come out. And so I would be glad, if somebody asked me for a recommendation for a doctor and somebody went to my medical school, I would be glad to say, hey, use this guy who came through St. Louis University. But if they came from my residency in that institution, I'm not going to recommend that they go to a doctor just because they went to that institution.
Wow. That's quite the environment there.
Yeah. And I think back to even the attendings in my specific residency program, and no, compassion was not what we were about. And a patient perspective. It was about doing the work of, how did they say it? I'm here to save your butt, not kiss it.
I've seen that. That seems like an ER position.
Is it comforting an emergency patient comes in and says, doctor, is this going to be a successful surgery? And the doctor says, well, that, my friend, we're about to find out. Is that comforting?
That's what we're about to find out.
We'll see.
Interesting. You speak about the field of surgery. Surgery at St. Louis University kind of had a reputation for not being all that great at the compassion end of things. Certainly not when it came to the poor medical students.
Surgery in general.
So that was kind of an exception to that institution. But yeah, you say surgery in general. And then I come to Auburn where we have these great surgeons, wonderful people who you enjoy talking to and would trust your family to, actually make a referral for your family member to get a procedure done by them. Right. It's a wonderful thing. It's like a dream to practice medicine in Auburn when it comes to who you have for your surgeons to refer to. Jenkins, Bradshaw, Antonini, and Zaria. Very good. Great group. Anybody watching this who's in the Auburn area and needs something done that's done by a general surgeon, Auburn. I can absolutely endorse these guys.
Let's talk to some of the people again here.
Okay.
Sure.
Bianca. She says she had 4 surrogate babies.
Oh, wow. I didn't know that.
That was a kindness. I always try to be kind. I can't help everyone, but I do what I can.
Wow, good for you.
Bianca, I never knew that about you. That's quite an acconnishment.
And Lindsay, who says, I can't imagine Dr. Mark experienced depression.
That was a dark time.
Yeah. Candace Curtis, emotionally exhausting to try to connect and act compassionately every day. Self-care is very important for medical personnel.
Yes, which Dr. Gwain touches on. Actually gives quite a bit, and links to resources for people who are caregivers and may be experiencing some compassion fatigue. Yeah. drgreenknight.com.
Go check that out for sure. Yeah, when we so it's that part has really come to a head with the pandemic. So and it's just really brought forth everything. We've seen people burnt out. We've been blaming it on a lot of things like, oh wait, what's that? There's a super chat.
Oh, right. Thank you.
She just says we need a super chat.
Okay. Lindsay.
Lindsay,
here's
one. Thank you.
You know how to start things off right. So thank you, Lindsay. That's. So thank you.
Yeah. Nice.
The new holiday cups are in, by the way.
Oh, nice.
If anybody cares who can't go to the local Dutch Brothers to see them.
Mine's bigger. Size doesn't matter. So anyways, we'll go back to compassion fatigue. So we blamed burnout on a lot of stress in the workplace, and the EMRs have been blamed a lot.
Make you taller.
Sorry, you didn't put the camera in the right place.
I know, it's my fault.
Or this year, this time. So we've seen that a lot, and that's kind of been leaning up to this. But now with the pandemic, it's fully just caring for people that is quote unquote burning people out, and that's what this compassion fatigue is. We are all in medicine for this because we like taking care of people, and that's what we're kind of called to do. And if you do that repetitively in a situation where you're experiencing chronic stress, chronic trauma from patients dying and getting really sick, going to the ER, it's taxing. And then, combine that with having to try to get people to do something and them completely denying that your expertise is even valid. That makes it really tough. And I'm sure I know you felt that. We've talked about this a lot.
Yeah, I had this patient this
Now I'm
morning.
going to get back down here. No, I'm just kidding. Let's keep moving.
I had this patient this morning that he was expressing he had trust in me, but then expressing distrust in medicine. And I had to explain to him that these people you're talking about, they are people I went to school with, that I went to residency with, or at the same time as, who got these positions in either federal or state or local positions of health directors. And so it's not a they that's different from me. Put me in the same boat with them, because I'm doing the same job with these people.
Yeah, you're
I'm
right.
helping them and they're helping me to try to help all of the patients. And there's this weird, this massive information that they're getting that's telling them stuff that's just not true. It is not true. And they keep listening to these sources of information without knowing that these people aren't qualified to say what they are, or they're passing along information that's not true.
Yep.
And somebody's making it up.
It's some of the stuff we've heard is absolutely
Politicians.
Yeah, there you go. So that was a frustrating experience, and continues to be on a regular basis until we get this misinformation pandemic addressed.
Another pandemic.
And it'll never go away, but there's some people who are hoping that at least it can be maybe reined in a little, so that we can at least be able to talk to our patients and have them accept what we're saying.
Sure.
Yeah. Okay. So would that be part of this other element that comes into the compassion fatigue called moral injury? Does that
a part of
factor in
it?
with that?
I think that can push you towards moral injury. Moral injury occurs when you are going down this path of compassion fatigue and essentially reach it, and then find yourself thinking or having thoughts that that completely contradict your normal morals. So, for example, there have been times where I've had to give somebody the diagnosis of COVID who's not vaccinated, and there's a part of me that's just like, you know what, you deserve it. You didn't get vaccinated.
Oh my goodness. Should we be saying stuff like that?
I'm being honest here. It's a small part of me, and I have had to stop and slow down and really examine that part of me. You can't say that you have not felt that way.
I have that thought. I'll admit it too.
I'm just being honest here. And it's not
you
okay.
feel guilty.
That's not why I went into medicine. That's not why I'm a doctor. So I have had to stop and examine that and talk to people about it, and even do some little counseling to try to get through that.
Yeah.
So.
Yeah. Oh my goodness, Laura!
Hey.
Thank you, Laura. This is a good day.
She agrees with Lindsay, but I don't know what she agrees with. What did Lindsay say?
They're having their own conversation typed out in the comments, separate from the show, which is fine. We provide community here on YouTube. So were there other comments or questions?
She said, how do you trust a medical doctor but not the field of medicine?
That's
good question.
That's the
so we see this on both sides. Most people who essentially trust medicine and trust the establishment that's out there, that includes the CDC, FDA, and the process by it goes, they kind of trust this big field of medicine. But then you have these doctors who are on the outside having some weird things, and they don't trust those. Whereas it's completely opposite on the other side. But I would say that, 95+% of doctors agree on what we're saying. It's the rare guys that are out there that's saying, hey, don't get vaccinated, or touting some, horse dewormer or something like that.
horse dewormer?
Yeah.
Yeah, and other things like that. Yeah.
And so that's definitely the minority. The problem is in today's world, they get the same voice that everybody else does, depending on the media you consume.
I was going to say, if your world of social media is the one that listens to, and obviously people watching our show are not going to be totally wrapped up in that world that gets
Probably not.
What's called America's favorite doctor, frontline doctors.
Yeah.
With
You subscribe to a reputable
yeah,
source of medicine.
We are real doctors.
How do
can
you
look
know
us up.
So that
can
brings us
check
back
our
to
license
how do you know
credentials.
that?
Yeah.
How do you know that we're reputable? Well, I would say don't take my word for it. Go double check things with sources higher than me.
Yeah.
Which would be the CDC.
Except they don't trust them either.
Yeah, that's a problem.
So
When you start to lose, there's no
Yeah.
truth.
You have
and
nowhere
when
to
you
go.
when you lose your reference for truth, you can't trust anyone.
So they.
But apparently you'll trust some random
I was
person
going
on
to
the
say
internet.
they still trust something.
Well, it's all just confirmation bias. You'll trust whoever says what you think you're thinking. So as long as you can find somebody who says what you're thinking, okay, I don't like giving my kid this vaccine. Okay, I'm going to find a doctor that's saying that, and that's the person I trust. Why? Not because they have any credentials behind their name, because they're saying what you want them to say.
Yeah.
So all of us need to take a step. We do too. We need to take 2 steps back and look at this and reevaluate where we're coming at things. Is vaccinating kids a good thing? I had to go look at the literature. I wasn't going to take Fauci's word for it. I wasn't going to take the CDC's word for it. I looked at that study, and I looked at all the things that came from it, and I came to the same conclusion that they did.
Yeah.
That
And I'll
it's
actually take
appropriate.
a step back from that and say, I'm not reading all of the studies because there's so many of them, and I'm not making judgments on how they were
I'll
conducted
read all of them,
and the
but the
methodology.
big ones like that I do.
Because, I do read, but not all of them. Like
There's
ivermectin,
way too
for
many.
example.
There's way too many out there.
I did
You're
not
right.
read all the studies on ivermectin. I don't have the time to read all of them that were done on
No, you can't.
horse dewormer. And a lot of them early on looked positive, and then they got published in Lancet and was it New England Journal? Was that the other one? And then they got withdrawn when they found that the data was bad, and they were like repeating groups of patients.
The big, The big thing is we looked at the,
And then the NIH study came out.
the bigger reviews of the studies, which is.
Well, there were problems with reviews too, because the reviews were skewed toward the
And when they finally removed all of the
repeated patients and made up data,
things,
and
they finally.
Seems like
Gave us
people
some
are with you
information.
here. Catherine is saying you must have exercised so much restraint when they refuse vax. But when they get it, then they want to trust medicine.
yeah.
It is an interesting dichotomy that you're willing to accept a treatment for a disease that is brand new and actually not out as long as this vaccine, even.
Right.
Versus a vaccine that has a little more research behind it. It's interesting. People still come to me when they have other things. They trust me for other things. So it is weird that, and then for some reason, this topic, because it's been so politicized, I believe, and there's so much bad information out there, people trust me on many things that I tell them. But then we bring up this topic, and all of a sudden, all of their defenses get up, and I am not having their best interest in mind for some reason. It's weird. I'm sure you've noticed that.
I
too.
hesitate to go deeper in who the group of people are and
there's no need to do that.
who's influencing them, and yeah. So obviously we're kind of preaching to the choir here, which sometimes you need that. Sometimes you need a little bit of rah our team, but we're not changing hearts and minds out here. If somebody doesn't like what we're saying and they're convinced of the other, they're just going to write troll comments and move on.
Sure.
Or leave
it'll
a
still happen.
nasty message on our office phone machine for our ladies up front to hear. And those of you that follow my Twitter can actually hear that.
Wow.
I bleeped it out, so you won't hear
It's PG at least.
all of the words that were used in the original
Use
message
your
left
imagination.
for our office staff to pick up. Yeah,
Yeah, that's a little inappropriate.
yeah, not a little.
How often is that?
That was a one-time thing. Thankfully.
Yeah.
Yeah, and I actually gave it to Dr. Vanessa Walker, because she has been so much out there in front on the news. Because this was like the weekend that I was on the news talking about vaccinating children.
Yeah.
It came after that. And she said she's had stuff written, but never voice calls, messages left on a phone machine for her.
Yeah. And she's really been an advocate for the vaccine, rightly so.
Yeah.
Even did a vlog on her kids get vaccinated between the ages of.
Yeah, she put that on
They're
her
young. They're between
Life on
5 and
10
11.
channel.
Yeah, and of course they did fine. So
Okay, so we talked a little bit about compassion, wasn't exactly what I thought we were going to talk about. I thought we'd talk a little bit more about what the book had, but I'm glad we touched on what we did, because that's kind of what I thought we needed to address and what our audience would want. Anything else before we wrap up? Mr. Ed, do you have any great comments there off of the chat?
Well, Bianca says again, if I want false info, I'll watch the BBC News and read the Sun.
Oh my goodness! Wow.
Can't say that I've had that much experience with the BBC.
And then Lindsay Antoine had one last comment on the bottom there.
The argument of not taking the vaccine because they don't want to crosses over into the territory of public health, where it definitely does not hold up well.
The taking away from any ability of public health to take actions to protect us is concerning for, they're making them have less influence on what they can do as far as helping to control disease. And it could be a problem in the future. If there was something that was a little more deadly than this or a little more contagious than this in the near future after the changes have been made at county and state levels, there may be things that people will regret having made possible. Yeah.
Right.
Okay.
Here's a question.
Yes.
Do you two believe in natural immunity?
Absolutely.
Should be viewed the same or better than the vaccine?
Studies go both ways.
Studies on
the Israeli study that came out earlier suggested that natural immunity was the longer lasting of the two. And then the NIH did a study, and it looked like the vaccine was actually the better way to go. So I still encourage anybody who's had the infection and hopefully has natural immunity to also get the vaccine. It's the safer way to go.
As I did.
Yeah.
I've had COVID and been vaccinated.
But I would like to see if we could have some way of knowing from doing antibody, and we don't do antibody levels. We get patients requests all the time for antibody levels. We don't order antibody levels. Don't ask right now. In the future, we might.
I can see.
We don't do antibody levels.
I saw one occasion where doing that actually convinced a person to get vaccinated.
Oh, really? Interesting.
Yeah.
Okay.
But usually it's the other way. You do it, and it doesn't change anything.
Yeah.
Unfortunately. Have you both been boosted?
Not yet.
So no, I haven't. And,
I'm going to, though.
Yeah, so I
just haven't done it
had
yet.
COVID, as I said, and had both of mine. So actually, I am waiting until my kids get their vaccine, and I'm probably going to do it around that time so that I can
family
with
event.
them. Yeah. Let's go get our vaccines.
And
but my daughter's not quite 5 years old, so once she turns 5 at the end of this month, we'll all go together.
Yeah, I tried to get mine on Fridays so that I won't be feeling sick on a day of work.
Yeah.
And we've got family for the next 2 weekends that I don't want to feel sick when they're around. So that's why.
I've got some every weekend. So it's tough to make that.
Maybe like midway between Thanksgiving
We are
and
still
Christmas.
fully vaccinated according to the CDC.
Yeah.
And we're safe.
Yeah. But we do encourage people to go who at this point have been made eligible. That'd be everybody over 65.
We would, yeah. And truly, that's not the fight. I have not found that getting people to get their third vaccine is not the big thing. It's getting people to take the initial step. That's really
the first
where we're putting our efforts.
And that's the one that's going to make more difference for all of us.
Yeah, absolutely.
Yeah. Mm-hmm. Even the people who already have been vaccinated, it's having people who haven't started the series get vaccinated that makes us safer.
Yep.
Strange concept.
The question is, too, how many more boosters?
Yeah.
Don't know. We'll see.
Yeah. Is it every 6 months? Is it
once a year? Is it like a flu thing?
I've seen some.
We'll see.
Some speculation that this booster will get us much further along, and so to have another one would be more than 6 months out. But we're not there yet. We don't. People haven't had the booster in them that long to find out. We're learning as we go.
Ongoing study.
All right. Well, thank you. Thank you, Holly. Thank you, Mr. Ed. Thank you, Dr. Gawain.
Santa.
It's Santa. Anybody that you want to thank for?
Somebody was offering money if
we'll take it.
Gawain would sit in Santa's.
If you would what?
If Gawain would sit in Santa's lap.
Offer money.
Try it. See if it happens.
No. We both say no. Thank you. I appreciate that.
Why did they do it for you and not for me? Because I would do it.
You probably would. But would Santa let you? That's the question.
I might hurt him.
We don't do things on the show for money. he says as he drinks
Dutch Brothers. Nice.
Anyways,
Okay.
over at drgreenknight.com, check it out. It is on compassion fatigue, a very hot topic in the literature. What are you trying to sit on your lap? You trying to sit on my lap. I do have a Patreon over there. Check it out. And I would like to thank Teresia Rowatt for what you do.
Yes, thank you. And also Lindsay Antwine, very much. And all the people who have their name on the little list that goes along the screen after the show. You can see your name there by going to Patreon. What is it? It's patreon.com/Dr. Vaughn. It says right on the screen. Anyway, thank you all. Till next time, Dr. Wayne, Dr. Marr, Vaughn telling you to stay in good health.
Doctors, thank you for another informative session. Auburn Medical Group is located in Auburn, California, USA. Thank you for participating. Please tell a friend and join us again next week.